Hey. You all can share the video. I'm trying to share it myself. I'm good. How are you, Nicole? Let's see, Ederra page. Hi, Angie. Hey. Everybody that's come on, can you share the video and let people know that I'm on? There, I shared it. Hi, Letha. Hi, Ace. Hi, Wanda. Hi, Talay. Welcome. So I'm going to try to make this concise because it's late. I have a lot to do tomorrow. Hi, Zizi. Hello. Hi, Shannon. Hi, Courtney. Share. Hi, Deshawn. So, I was going to talk a little bit about liposuction results. The last picture I posted a couple days ago, the last before and after I posted, that lady was only 6 weeks out, and her result looks fantastic for 6 weeks out. When she came in, I was surprised at how little swelling she had for 6 weeks, because normally at 6 weeks there's still a substantial amount of swelling, and she had hardly any. She looked like she was 3 or 4 months out, and I was like, what did you do? Because I knew it had to be something more than just normal, and she did a little bit more than normal. So I'm going to talk through what I recommend for my patients post-operatively after liposuction, and then I'll actually share the things she basically did what I told her to do, only extra. Oh, Shannon, I'm glad I'm doing your surgery too, sugar. So liposuction is a wonderful and very powerful tool in plastic surgery in my arsenal. It's actually one of the most common procedures that I do. I do more lipo than anything else. It just kind of happened like that. And so over the years, I've learned different things to maximize the result, and my results have gotten better and better. As with any human, the more you do something, the better you get. So, and also sometimes when I talk to people, I realize that some of the things that I have my patients do after surgery, everyone else doesn't. And so, I'm not telling anybody to do anything outside of what their surgeon tells them to do. You have to follow the recommendations of the person who did your surgery, because sometimes, even with my patients, I'm like, okay, we're not going to do that on you just yet because of whatever may have happened in the OR or because of what their physiology has going on. So anything that you learn on this video, you should run past the doctor who does your surgery before you do it, because I wasn't in your surgery. So always consult with your own doctor. I'm not anybody's doctor on here unless you're actually my real patient. So today we're going to talk about liposuction and how to get the best results. So liposuction is a really great procedure when done on the appropriate person. One of the things that is really important to getting a good result is actually being a good candidate for it in the first place. So I think it's important that the person you go to is actually a plastic surgeon and someone who's capable of offering you something else if something else is more appropriate. Because if you go to a place where they only do liposuction, they're probably not going to send you out the door to somebody else if you need something different, and they'll probably just still try to do it anyway. So thank you, Crown Queen. So you need to first be a good candidate for it. So a good candidate for liposuction in my practice is a person who has we're going to talk about liposuction on the abdomen, like the abdomen flanks back, like the lipo 360 kind of person. So a good candidate for that for liposuction in my practice is someone who has excess fat on top of the muscles, like so above the muscle layer, in any of those areas that I just discussed, abdomen, flanks, back. They're in a normal, healthy BMI range. And I'm not telling people they have to get super skinny. I'm not trying to ask somebody to get down to a BMI of 25 or nothing like that. I actually have a very generous BMI cutoff, in my opinion, which my BMI cutoff is 33. No, a person with a BMI of 33 is not skinny, but it's important that you're not like super overweight to the point where we do the lipo and you look similar, even though I just took 5 or 6 liters off of you. If that's the case, you need to lose weight first. The other thing that's a big issue is whether or not your skin has good tone to it. So if your skin has lost its elasticity because the elastin in your skin was damaged from weight going up and down, or it's just your protoplasm. Like some people just have loose skin. Some people's skin, it may not be hanging, but if you grab it, it'll just pull all the way out. Like if you have that type of thing going on, then, you know, getting liposuction alone, you may end up with extra skin. So if you're a person who is a good candidate for liposuction and then you proceed with liposuction, what you can do afterwards to make sure everything comes out as best as it possibly can. Number one, post-operatively, you need to be in a compression garment or faja, whatever you want to call it. I call them compression garments. You need to be in a post-surgical compression garment that is the appropriate size. So one thing that happens when with some people is like they'll go and get liposuction somewhere and then they'll see them like maybe one time after surgery and then they won't see them anymore, and they'll be in the same garment for like 6 weeks, and then they come out of the garment after that, and then they look up 3-4 months later and they're like, I don't feel like nothing happened with my lipo. Well, it's a few things that happen there. One, you need to wear the garment more than 6 weeks. 100% of people are still swollen at 6 weeks, with the exception of that one lady I just posted. Like, she's the only person that I've seen that didn't look swollen at 6 weeks, but she was doing like extra stuff. But like 99.9% of people is still visibly swollen at 6 weeks. So if you come out of the garment and you're still swollen, you're gonna heal swollen. And what that means, so like, okay, like y'all know I like to draw pictures. Okay, we're gonna say the person is standing upright. This is their muscle layer. This is where the fat is. Okay, muscle layer, fat, skin. Okay, so then you get liposuction. I come in, I lipo it out, I'm lipoing all in there, and you end up with you go from this many fat cells to this many fat cells, right? So if you didn't wear a garment, it would sit like that, and you would lay down collagen or scar over time. You would lay down collagen or scar in the space where the fat used to live. You see that? Little squiggly lines is collagen and scar being deposited where the fat used to be. So the compression garment, what we do, okay, so this is how you were before lipo. This is how you were after lipo. If you compress, you end up like this. Here's the fat, here's the muscle layer. This is the fat cells that remained, and then the skin gets pushed up against it. The space where that other fat used to live gets closed off with the compression garment. The compression garment sandwiches the stuff back together to the new size. If you don't wear a compression garment, you end up with this one where you got fat and scar tissue all in the areas where the fat used to live. And so this is how you can end up, even though you had this to start, you end up here if you don't wear compression. You heal like this. And so you lay down all of these little, you see all these little squiggly lines? That's scar tissue that you lay down in the place where the fat cells used to live. So I see a question that says, can you get the scar tissue removed? Not really. So you can't liposuction scar tissue. So what happens when you go into this and start liposuctioning? Well, in here with these some of these little squiggly lines are blood vessels. So because in order to lay the scar down, you got to bring blood vessels and new blood supply in to bring the tissues that create scar. So when you start trying to liposuction in this, you'll get a couple of these, the last fat cells out, but then all this stuff, these squiggly lines, they just start bleeding. So you'll never get here if you end up here. If you go from here to here and then you try to get some more lipo again to do it right the next time, you won't get here. You'll get okay. You'll get here. So this one's still a little bigger than this one. So if you get lipo, don't wear compression, so then you lay a bunch of scar tissue in the space where when it was like this, you lay a bunch of scar tissue in all of this dead space. And then you go try to get lipo again and you actually wear your garment, you'll end up here, which is better than this, but it's not that. So that's the first thing. You need to wear adequate compression, and you need to wear it long enough that you have the collagen formation has stopped, and maybe just some remodeling is happening. That's okay. But when you're still actively laying down collagen, you need to definitely be compressed and have that space closed. Then that collagen formation and that scar tissue that forms, which is normal, functions almost like paste and keeps those tissues together. So number one, wear adequate compression. Now, when you're wearing compression, you have to be paying attention to when it's time to go down in size. So you don't want to stay in the same garment for the whole 3 months. You should be shrinking. So as the garment gets easy to put on, like when you first get the garment, you're like, and then you're like trying to zip it. When you start being like, that means it's time for another garment. If you're just jumping in there all fast, real easy, then it's not doing its thing anymore. So you want to make sure you got to work to get into it and it's giving you good compression. So make sure you're actually wearing a garment, and then make sure you're downsizing when appropriate in your garment. The other thing that happens a lot of times where, when women have like the bra rolls, even with the belly, if you have a little bit of hanging skin on your belly and you're putting a compression garment on, and the compression garment, okay, I gotta draw another picture. This picture is bad. It don't look right. Hold on. Okay. So if you got a little pooch, this is her butt, this is her belly, right? So if you got a little bit of a pooch in the front, and then I lipo it out, and then this starts to hang a little bit, and you put the garment on and you smash it down, and the garment is accentuating the folded skin, then you're gonna heal with the fold like persisting. So like when I have people put their garment on, if the skin is folded at the bottom of your belly that you're trying to make go away, you need to put the garment on and stick your hand down there and pull that skin up and spread it out so that it's in the garment flat, not like this. And that'll help it to heal flattened and without the little hanging skin. That's important. So the next thing with bra rolls, liposuction it all out and you put the garment on, and sometimes, especially when you're trying to get the garment to be as snug as possible, it'll fall into those creases and you're trying to heal with this smooth, but the garment is pushing into the creases. Well, guess what? You'll heal like that. The scar will heal it with the crease still in it. So when a person has those creases, you need to put foam in there as an interface between the garment itself and your skin and spread that tissue out in there, have the foam in there so that the tissue is straight and not like this, because it'll heal with the fold. If you have the fold in your skin with the garment on, that's how you're going to heal. So, the other thing is your diet. So, and I don't mean necessary from a calorie standpoint. Of course, we don't want you to lose weight, but if your weight is stable and you're not eating a whole bunch of calories necessarily, but you're eating a whole bunch of salt, you're going to be swollen as all get out. So like some people will be like looking real good and then they'll call like, I don't know what happened to my result. And I'm like, did you go to Taco Tuesday? Were you at wing night? Did you have pizza last night or Chinese food? Some of these things that are super high in sodium, and usually the answer is yes. So that will make you sweat, that you'll retain sodium, and then with that, water stays with it. So you want to be flushing the water, the salt out, and like paying attention to your salt intake. So you want to drink a lot of water and reduce the amount of salt that you take in, because that affects your swelling. The other thing that affects swelling is alcohol. So when you drink alcohol, it makes you swell more. It just is. Cigarettes make you swell more also. So those are things that you want to keep at a minimum while you're in the first 6 to 12 weeks after your surgery. Taco Tuesday will tear up your outcome, honey. Just say no to Taco Tuesday. Then there are things that can help you, like pineapple juice, bromelain. Bromelain is in pineapple juice. Arnica, Montana. These are all natural things that can help reduce swelling. Pineapple juice. Oh, turmeric helps with swelling. So those are all good things. The other thing, weed. I don't know that weed hurts it. I don't know that weed makes you swell more. I don't think that applies. Lymphatic drainage massages. This is where that lady went in. So lymphatic drainage massages are so necessary to get the absolute best outcome possible. If you didn't get them and you still got a good outcome, it would have been a better outcome if you did get them. So with my patients, you get 2 complimentary lymphatic massages with your surgery. Most people use those the first week. And then after that, for the first 4 to 6 weeks, I really would like everybody to come weekly or wherever they live, because a lot of my patients come from out of town. We try to make sure they understand beforehand to have somebody lined up to do their lymphatic massages when they go back home, at least weekly. Then this particular patient, she was literally getting them every day. She got them every day for 6 weeks. So she went to the professional every other day. And then she had the professional teach her husband, and he did it on the other days. So she got lymphatic massages, real ones, every day for 6 weeks. I was like, oh, oh, that's a good idea. But most people can't sustain that. But that was the extreme she went to look like she had no swelling at 6 weeks. I was like, well, how did you do that? I'm like, didn't I just do you 6 weeks ago when she came in? I'm like, is this a 90-day or a 6-month follow-up? Because she looks so swell-free. It's crazy. So those are really my tricks of the trade. I don't love the abdominal boards. I used to give them to everybody. I just started seeing too many people were like right where the abdominal, because the abdominal board isn't tall. So like right where the abdominal board stops, it'll be bigger up there, because wherever the compression stops, the swelling starts. And so then they're healing, swollen up here, and they're flat down there. And I was like, So I don't really use those anymore unless I have a really good reason to do it. I just have people use foam. Like they can use a couple layers of foam or whatever, but the abdominal board, I don't love it. So I don't really have them use that anymore. Can you give a list of those natural remedies for swelling? Arnica montana, turmeric, pineapple juice, refrain from smoking and alcohol, and wing night. Monique Michelle. What's the soonest you recommend to fly back home having Lipo 360? 5 days is how long you need to stay after surgery. You also have to come in town 2 days before surgery to get your COVID test at the hospital that I use. I don't do awake lipo anymore because of COVID. So everybody has to, go to the surgery center. Okay, Nicole, thank you, sugar. Does anyone know gluteal contouring is included with lipo? Gluteal contouring is included with lipo if you pay for gluteal contouring with your lipo. So lipo is like areas. So that's just another area. I saw somebody asking about my consultation fee. It's $500, yes. $250 of it will go towards your surgery if you secure your surgery date within 7 days of a consult. Cellulite is, there's not an optimal thing for cellulite removal. It can, there's things to improve your cellulite, but that's something that keeps kind of coming back. You got to keep working at it. So the things that I offer that help with cellulite is an ongoing thing. Once we get you looking better, because you're never going to look perfectly smooth, you need to get maintenance treatments, in intervals to keep your result. The amount of time my out-of-town patients have to stay in town depends on the surgery they're getting, and it depends on how far away they're traveling, and it depends on, that's it. Which surgery and how far away you live. Oh, and if you're traveling by car or plane, it might vary. Hey, Shanna, my whole family's in Graysville. You have to wear the garments for at least 3 months after liposuction. And it's not like a switch. It's just like, this is what I help people understand. I don't know. This might be, if it's some millennials on here, you might not know what I'm talking about, because people don't really get wraps no more. But when I was, in my teens and 20s and stuff, when you go get your hair done, you get a wrap. And you sitting they wrap your hair around your head, and you get under the dryer. And depending on how long your hair was, how thick your hair was, whatever, determine how long you're under the dryer. Well, the dryer can only be set for 60 minutes. So your stylist puts you under the dryer with your wrap, turn it on for 60 minutes. And then you got long, thick hair, and the dryer cut off, and then you lift the top up. And then they come over to you when they finish doing whatever they're doing, and they run their fingers. They're like, girl, you still wet. And you like, with the dryer cut off. So now you got to go back under the dryer, and all of that 30 minutes you was sitting there, you could have been 30 minutes, you could have been done. So I said all that to say, just because you hit 90 days, you have to evaluate whether you and the doctor need to evaluate whether or not the swelling is actually resolved before you determine if you are appropriate to come out of the garment. Most of my patients, I would say 75% of my patients are able to come out of the garment at 90 days. But there's some that come in, I'm like, you can't come out. So, I see everybody at 6 weeks and 90 days to evaluate, and if they're still swollen, I'll see them more until it's resolved. After Lipo 360 and wearing a file, will you continue to get a small after wearing a file for 6 to 7 months? It just depends on where you started, and it depends on how much swelling you had. If you still have some swelling persistent at 90 days, you'll keep getting smaller until it's gone. Is the price cheaper if you only have lower lipo? What do you mean, like just lower belly? I don't do that. So when people are like, oh, I just want the bottom of my belly done and the top of their belly, they don't think it sticks out, but when the bottom goes in and the top is sticking out further than the bottom, that looks strange. And then, so I won't do that. I just offer full abdomen because I'm not about to do something that's going to look strange because a person can't afford it. I'd rather you just wait or don't get it at all, because how you look before that is normal. Even though it might not be what you want, it's still kind of is normal. But if I go and take the fat away from the bottom and leave it at the top, that looks strange. That's not normal. So I don't do that. I'm booking into May right now. I have 2 surgery dates. So we had 3 today, but one of the spots got taken. I think I have, but it can't be for like a mommy makeover. It's only 3 hours of time for each one. It was so only thing that can go there is something that would only take 3 hours. So like a tummy tuck or a lipo 360 or something like that. But you can't be like, oh, I want a tummy tuck and a breast lift. And if you're getting all that, I'm booking into May. One lady got pregnant and somebody else had a death in the family, so they needed to reschedule their surgery. So those dates just popped open, those spots. I don't put DD Ranger asked if I put drains in. I don't put drains in for liposuction unless they're getting a BBL, and then they'll have one drain in the back for like a day or 2. But normally with liposuction, no drains. With tummy tucks, yes, drains. If you're a flight attendant, just a week. I would say wait a week or 5 days. If you test positive for COVID, we'll reschedule you. You won't lose your money, but you're not getting a refund. So you would be rescheduled. We wouldn't charge you to reschedule you. We would, reschedule it. Do you keep your clients overnight or send them to hotels? If they are getting a surgery that takes me 4 hours or longer, I have them stay overnight. Otherwise, they go to a hotel. I don't like recovery houses. And I don't surgerize my patients within an inch of their life, so they don't, if they need to be monitored, that should happen with monitors and nurses and doctors available. So if someone needs to be monitored, they stay overnight at the hospital or surgery center. Is the process the same for a tummy tuck? What process? If your patient definitely needs a tummy tuck, do you recommend a tummy tuck first or BBL? That depends. It depends. That's something I decide on a case-by-case basis. How long do I have to wear the compression 24-hour period each day? 23 hours a day. Take it off the shower, put it back on. After liposuction, I'll do tummy tucks like 3 months later. If the person is still kind of inflamed, because if it's a person who I had to do a lot of lipo in the front, then they may still be inflamed and the tissues might not be movable yet at 3 months. So most people, I can do their tummy tuck at 3 months, but some of them we have to wait longer. It just depends on where you start. Yes, I know I saw you yesterday for your out-of-town patients do virtual follow-up appointments. Yes, I like to see them once in person at 4 to 6 weeks after surgery, and everything else can be virtual. But some of the people with everything that's been going on, we had to do even a 6-week virtual, but I prefer not to do that. Consult is $500. $250 will go towards your surgery if you book. If you reserve your surgery date within 7 days of the consult. No, I don't give a meal plan for any surgeries. I just, I tell people what to avoid to keep them from having extra swelling. Make sure you eat enough protein, but I don't give a meal plan. Is there a point that the swelling will completely stop after lipo, or will you have to always deal with swelling periodically? Sometimes you will have swelling periodically for like about 12 to 18 months. But it does come a point where it completely goes away. I'll be glad when I can afford to get my lipo done by Dr. Milo. Oh, thanks, Letha. Love your live videos and appreciate all the straightforward information you give. What BMI do you have to be to have lipo? 33 or less is my BMI cutoff for lipo. So I called to see if I could get a consultation. I think I'm going to schedule my appointment for next June or July. If you want next June or July, you better call because we're in May now. So by next week, we'll probably be in June. You can get a consult now, like, you know, soon. But you can't get surgery soon, except for those 2 days that just came up that'll probably be gone by tomorrow. So for lipo, yes, I have an appointment before May for lipo 360. I have 2 of them. And I'm planning to fill them in the next 24 to 48 hours. I have November, I think it's November 11th or 12th, and then December 3rd, I think, are the dates. And May is available after that, yes. Okay, Keisha, I'm glad you asked that question. I want to know, do you get the $250 back out of the $500 if you choose not to get your services? No, that's the reason why I have that consult fee. So I don't work for free. So if you choose to go with someone else, then you pay $500 for my time, expertise, all of that stuff. If you choose to go with me, a portion of that will go toward the surgery. That's the whole point, so that my time isn't wasted. I have so many videos on Facebook, on YouTube, like hundreds of videos. So usually by the time people come to me, they've decided that they want me anyway. So I think there's enough information that I've offered for free for people to be able to get an idea of the way that I think, my morals. I have before and after pictures up for people to see what my aesthetic is like as far as surgery goes. And so, you know, it's just gotten to the point where I don't really have time to consult with people who aren't serious because my time is getting slim. That's why I'm booked all the way out until May. I can't just be seeing everybody because they're like curious. So that's how I was able to like get some of my time back because I'm spread really thin. Because I actually do my consults myself. So you don't sit up with a salesperson and they're like, okay, you get it, and they upsell you on all these things. That's not how it works in my office. You come in, you get, you fill out your paperwork, you get before and after pictures taken, but my staff does that part, getting your gown, and then I come in and I evaluate you myself. We have a conversation about your health history. I do it. And then we talk about your options for surgery, and go over all that stuff. I'm usually in the room with my consults for at least an hour, sometimes longer. So I can't do that for cheap. So if you decide to go with someone else, that's totally fine. It's just you don't get anything back if you do that. If you gain weight after a tummy tuck, the fat goes back everywhere except your belly will not get as big as it would have gotten had you not had the tummy tuck. Yes, only $250 goes towards surgery. The other part is my time for doing the consult. Crystal, you were asking the same question. It's the same answer. It depends on the person. I got to see them and see, you know, like the answer is not going to change. I answered that question already, Keisha. Montgomery's a clue, but you need another. Yes. It's 33 for everything, the BMI. I'm assuming, I'm not really sure, Keisha, why you keep asking that question, and I answered it like already. You don't get anything back if you decide to go with somebody else. It's all gone. You pay me $500 to spend an hour evaluating you. I'm a surgeon. My time is very valuable. Last year I put down deposits is still good. Call my office, Tamara. That's not like a question for a Facebook Live video. Give us a call in the morning and they can help you out. Should I get fibroids removed before lipo consult? That's kind of hard to say. Like, fibroids is not a contraindication to liposuction. If you're about to if the surgery is scheduled and you know you're getting your fibroids removed, I would say get that taken care of first. But if you know, it's not really, they're not really related unless you have like fibroids so big that it's actually making your belly stick out. No, Venus, you don't need a consultation. Just call. We already met. I already know you. Just call the office and tell them what you want. How do you feel about doing nose jobs or face work on Black people being a Black woman? I don't do nose jobs. I do other things on the face, so I do kind of everything else on the face. I just don't do noses. It doesn't have anything to do with me being Black. I can take care of Black women, white women, Asians. It's, I enjoy face work. I enjoy the face. After weight loss surgery, I would recommend you wait until your weight has stabilized. So 6 months to a year, usually about a year after your weight has stabilized before you get any cosmetic procedures, not just lipo, any of them. Yeah, I don't recommend recovery houses. I don't send my patients to recovery houses. Nikki, I don't take care credit, but I do accept Alpheon and Lending USA. So we do have medical financing options, just not care credit. And then people can also book their surgery out far and then pay toward it, but you have to be paid in full 30 days before surgery. I don't do J plasma. I didn't too much care for it. The consult doesn't expire. Like, if you've consulted with me before, you don't have to pay another consult fee. Even if you consulted with me when I was a first year in practice, you don't have to pay another consult fee. The quote is expired if you consulted with me 2 years ago, because my prices changed. So your quote will have expired, but the consult, we would reconsult, but I wouldn't charge you for it if we've consulted before. So if you've consulted before, the $500 consult fee doesn't apply to you. You are in already. And even my skin clients, if you consulted about skin with me, then you don't get charged to talk to me about something else. Yes, you have to be at your BMI to get Lipo 360. Yes, it's true you have to pay for hospital supplies and services. Who else is going to pay for it? And they're not going to do it for free. You got to pay for OR anesthesia fees, and then you have to pay surgeon's fee. The OR anesthesia fees are paid directly to the hospital, and the surgeon fees are paid to my office. The hemoglobin A1C, if you have diabetes, it's not a contraindication. It's not an absolute contraindication, but I don't operate on diabetics unless their diabetes is in very good control. Very good control. So if your hemoglobin A1C is like over 6, then it's probably not under tight control. So no, hospital fees are not included in my fee. I get paid one thing, the hospital get paid something else. When we give you a quote, though, we'll have the estimated amount of time that I think it's going to take me based on the procedure and your size and all that stuff. there's always variables, and it may take longer than what I estimate. And if it takes longer than what I estimate, the hospital will bill you for the difference after surgery. So, I try to give pretty accurate estimates. But with liposuction specifically, one of the things that can make it take longer than I plan is because everybody's fat doesn't act the same coming out. So some people's fat just jumps out. It's like, let me out. And then some people's fat being there like, holding on for dear life, trying to keep them coming out. And so it may take me a lot longer to get to where I'm trying to get to if you have stubborn fat, as opposed to a person who has fat that's like, let me out of here, please. So I try not to be like, it's like a fine line that I walk when I'm in the OR. I try to be respectful of people's money, to not waste time, but then we're here, you only have one chance to do it right the first time. And so I try to do the absolute best I can. And if it takes me longer than I thought because of whatever's going on with your body, then I do that. I'd rather you be annoyed by a hospital bill and happy with your results than like looking at me like, well, why is this still here? Because I hit 2.5 hours and I needed 30 more minutes. So it's like I had a lady the other day, which there was no way I would have guessed I would have took this much off of her back, but I took 4 liters off of her back only. And she was only 5'2". So that tells you a lot. I had no clue I was gonna get that out. That was not even what I was planning, but it was coming out. So, and I could see her shape changing right before my eyes. And so I got everything I could. So it took longer. And so, when I finished, I'm like, I got good news and bad news. The good news is I got 4 liters off your back alone. The bad news is it took me longer than we estimated. So they're going to send you a bill. I talk to people about that beforehand so that they're prepared and not, upset when they're like, but you said it was going to cost this much. The OR fees is an estimate. You won't come out of the surgery and I say, you owe me more money. No. It's like that same lady, when I flipped her over and did her tummy tuck, she had a hernia that I didn't find on exam preoperatively. And so had I found it on exam preoperatively, I would have charged her to fix the hernia. But I didn't, so I didn't charge her. I just fixed it. So you won't wake up and I'll be like, you owe me more money. But you may wake up in the hospital, you may owe more money if it took me longer than I planned. Yes, you can get lipo on someone with a lap band. I'm not going to get into the recovery house thing on this video. That's that's opening up a can of worms that I just don't really have an interest in. I just don't have an interest in doing that. For my patients, they don't need a recovery house. So that's an expense they don't have to have. I've been practicing since 2012. Yes, my office still offers laser vaginal rejuvenation. That's still my favorite service. High blood pressure is okay as long as it's controlled. Like, if it's uncontrolled, you can't get it until it is controlled. But, it's getting your blood pressure under good control, you need to do anyway. So you don't have, bad things happen like kidney failure and stroke and stuff. So. Hospital doesn't take care of credit. The hospital doesn't take any medical credit, like none of them. Because the finance fees for medical credit companies is way too high. Hospitals ain't doing that. So they'll just take regular credit cards. Yes, you can pay with a charge card, just not a medical credit card. The medical credit card finance fees to the business and to the consumer are crazy high. All right, I'm going to go ahead and get off. Because I'm seeing some of the same questions over and over again. So, if you are interested in one of those 2 spots, I advise you to call at 9 o'clock in the morning and see. I have a surgery tomorrow, but I didn't have any patients scheduled. After that, I was going to come home. But if somebody wants to try to get one of them 2 spots, then call the office in the morning and I'll let them know that if, somebody's trying to get one of them 2 spots, they can have a consult tomorrow after I get out of surgery. So It will be in the afternoon, like after 2. After 2, before 5 Eastern Standard Time. All right, I'm Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.ederrabella.com, or you can call my office at 678-325-0006. And for any of you who use Pretty RX or interested in trying my skincare line, it's on sale at 20% off until midnight. You got an hour and 7 minutes to save 20%. So the code to get that savings is Pretty Skin, and it expires in an hour. All right, I will check y'all later. Bye.